last but not least, I want to invite back Sam Guild, the president of AIM. I love this picture of you, Sam. Well, it's wonderful to have you back with Kaiser Permanente here, Sam. I remember the inaugural one we had a few years ago with your mother here as well. We love the work your family has done for melanoma. If you don't mind, please share with us, it's an amazing story that has brought AIM together.
Thank you. So first, I just want to say thank you, Thach. I love working with you and everyone else from KP. And Ray, you're phenomenal. Just jumped in when we asked for you to take on this amazing program that went long beyond what we actually thought. We thought this was just, for a year. And, people clearly love coming to and hearing you and your guests. It's a sad story. It begins with a sad story, as you know. So my sister was 25 in 2003 when she was diagnosed with stage 4 melanoma. Overall prognosis was 9 months, and there was only one treatment option available. She passed away the Monday before Thanksgiving. And my mother wanted something amazing to come out of her diagnosis and passing. And she went around the country and asked people what they needed, what the researchers needed. And what she inevitably heard was tissue. We need to find a cure. We need fresh frozen primary tissue to figure out, why certain people are diagnosed with, diagnosed with melanoma. Why do they progress? Which treatment options? And I think we're now 19 years later. She passed away during COVID, and I have been with the foundation for many years, and I readily stepped in and said, we need to make sure that, again, my sister's passing was for a good reason. I need my mother's mission to find that cure. It needed to happen. And so here we are, like I said, 19 years later, with our tissue bank, collecting tissue, and with working with amazing people like you and Dr. Liu and others to educate people and raise awareness about this disease.
I mean, AIM today does so much work for patients and the field. I mean, you encompass, the globe. I mean, I want to highlight this. I mean, there's just so many tools. You want to take us through? Because I hope everyone is watching. It's amazing.
So,
by the way, it's on, and if you go to your doctors, it's on their doctor's door, so you can take a card and take it home. But we will also send you a link to the website.
Yeah, thank you. So, as you mentioned globally, we are. We're very fortunate. We are now a global organization. We are in Europe, Australia. We're probably, I think, just every continent at this point. And a lot of these resources are translated and acculturated for the individual regions. So Anne, who's our director of community engagement, will pop some of those things into the chat and stuff as I move along. But the first is side effect management guides. We heard about earlier all the toxicity that comes along with treatment, unfortunately. And so we really want to support all of you in recognizing and managing those side effects. The longer you can stay on treatment, hopefully we help you improve the overall survival. We really want those treatments to work 100% for you. We have, I want to jump down actually. So we have Beyond the Clinic, Living Well with Melanoma, but we have an offshoot of that. It's from the clinic to the living room webinars. Ray touched on it briefly. Melissa is a melanoma lead at a cancer center here in the US. And we're fortunate that she can help address your medical questions. And she has her own series from the clinic where she brings in her own guests to discuss several of these things. So, for example, we have someone later this month, her and her guests will be talking about vaccines and what the future of vaccines in melanoma. She also has the ability to speak with each of you. You can reach out and ask general questions of her, and she could help you through all of that. We heard a lot about clinical trials, so important. I mean, although we've made great strides to this point, we certainly have a way to go. And so her and this matching service can assist you to learn about clinical trial options. It's something to think about from day one and at every treatment decision. So we could help you find a treatment option that works for you. Hope, oh my God, the stories that we heard from the patients, even I get choked up at times. It's why we do what we do, to hear amazing stories like that. So we have a library of survivor stories. There was some discussion going on about how to, you find support among other individuals going through a similar situation. So we have a peer-to-peer support program where we match newly diagnosed melanoma patients and caregivers with veterans, and they support each other. And then there's our Steps Against Melanoma walks, which is for two really important reasons. One is, again, we need to raise awareness about this disease. We need to, help people learn about how to prevent it, early detection, raise awareness about what they can do to support themselves if they're going through a journey, being around other people. And so our Steps Against Melanoma walks is focused on that, as well as raising funding research money. As I indicated, we have a fresh frozen primary tissue bank. And so the support that we get from those walks, supports that tissue bank.
There's going to be one in the Bay Area.
Yeah,
fall,
yes,
right?
Yes, I believe we have a date. Can I announce it?
Oh, please, yes.
Yeah, okay. So, we have several throughout the country. One of them is in the Bay Area on September 23rd. So we invite everyone to come out. We will have one in LA, hopefully that same weekend. We're going to be up in Oregon. We have multiple locations in Oregon, but with all throughout the country. I believe that's in the chat already, but we'll send links out. Again, it's free. You're not required, but we really want people to come out and join and support each other.
That's wonderful. I mean, it is such an amazing time for cancer. We just heard a State of the Union address to talk about the moonshot for cancer. When I think about, how we can talk about a moonshot for cancer, a lot of it started in melanoma. The fact that immunotherapy was developed as well as targeted therapies advanced in melanoma made a big difference, and that happened in trials. I love that studies that our institution had contributed to and many others, recently published in a really changing, not just how melanoma is being treated, it's affecting how other cancers are treated. So S1801 is showing that neoadjuvant therapy has better outcomes than adjuvant therapy. Even our patients who joined us today, in a few months, next year, they might have been treated differently. And I hope we can continue to improve that. DreamSeq, the trial that Patty was a part of. For so long, we weren't sure what we should start someone on, and we have an answer. But there's still a lot of work to do, right? I know, I asked Sam before, and she said it was okay that I could share that she also herself is a melanoma survivor, right, Sam?
Yeah, so I am. So I was diagnosed in my mid-20s, didn't really know much about it at the time. So certainly got a lesson in life when my sister was diagnosed. But it's part of the reason I am so passionate about what I do, because I have children and I worry about them. And now they have a mother and an aunt who both, been diagnosed with melanoma. So this research, again, professionally and personally, is just so important. And it's why, we offer these resources. But clinical trials played a lot in where we are in the advancements we are today. I mean, very familiar with S1801 and DreamSeq, and huge game changers. But there's still a lot of questions that need to be answered.
Yeah. And so it's great, that everyone is working together to help answer those, either by contributing data, analyzing data, or participating in trials, as we are all grateful to patients who are doing that. Being the organization that you are, how do you think institutions like Kaiser Permanente can contribute? What would you like to see?
Oh, so there's lots of ways. So one, sharing with your patients resources like AIM. So I talked about just briefly Melissa. I'll go back and mention her again. Patients are in the clinic asking lots of questions, but are feeling very overwhelmed by the situation. And so letting them know that there are resources like AIM, the patients can come and family members can come to us afterwards and ask their questions. We can, Melissa can discuss how to help manage side effects, questions to ask your doctor about their specific care, maybe possible clinical trials. And so we're supporting the patient, but also supporting the providers as well. You can't be on call 24/7, right? You can't answer the questions all the time. So we can support you and your patient relationship and the communication. So but when the next visit, it's a conversation that will really be fully developed. We also appreciate your help. When you guys come to our walks, and show the community that you care about them, you want to support them in and out of the clinic, and also support them and their families during this journey. And so, when we provide those sorts of opportunities, we always encourage centers to come to us, including advocacy in research. S1801 and DreamSeek, my mother was a part of that before I was. And so what's so important about it is that you're including the patient voice in, deciding which research to do, helping to make sure that, there aren't unnecessary obstacles. We hear about some of the difficulties with clinical trials, lots of trips, lots of visits. Those are things that we can hopefully help identify beforehand so that when the trial does open up, and then, of course, letting us know when the trials are opening up and if you need help, finding patients. We have access to a lot of patients. They come to us looking for trials, especially in mucosal, in uveal, those more difficult types of subtypes. We can, if we know that the trials are out there, we can help direct patients to them. So those are just some of the ways that, we really appreciate working with providers.
That's just wonderful. I think all of us as institutions want to do better. We've come a long way, but we still have so much more we want to accomplish, like you said. What would you tell other patients?
There's hope. Going back to my own experience, 10 years ago, the idea that we talk about no evidence of disease, the word cure, never used in a discussion. I actually remember the last time I think it was during the pandemic, the worst of it, when I was on one of these webinars with a provider, and she used the word cure. Unheard of. The fact that we even discuss that, patients, 10 years ago when I was with the foundation and talked to patients, I was always afraid I wasn't going to see them the next year at these events. And now that it's not the case, I actually look forward and I know that I'm going to see people again in person. I can't express to you how great what a feeling that is.
I was actually just thinking, like Joe, who finished in 2018, for other cancers, when you cure, you stop imaging at 5 years, right? That's like another milestone to think about, for how long and how are we going to watch? When the Moonshot Initiative was announced, I think, I don't know how many people know, it's built on President Kennedy's initial Moonshot Initiative. And at that time, going to the moon, I think was very much farther than where we are today with curing cancer, stage 4, because it's already has happened.
Right.
So, that's like you're saying, it's unreal to think of, the word stage 4 survivor, was started in melanoma, So I think it's a really exciting time. I think all of us are grateful to the work AIM is doing. Thank you for today. We hope there's going to be a lot more projects and works that we can do together. Thank you for all of you out there who came today to join us. I'm grateful to my co-chair, Sherry Sue, and Gars Taylor for organizing, as well as Rachel Coleman here for Kaiser Permanente for us, all our faculty and patients who came and shared their stories and expertise. Many thanks. Please look out for the link that we're going to be sending you that you can share with friends and family who maybe missed it today. Look for us online, in person, and in the future. Have a great day.
And I just want to say thank you as well, if you don't mind. I want to thank everybody. I want thank especially KP for doing this. Again, it's always such a great pleasure to work with you, and I want to thank everybody for joining us. I know it's different hours of the day for different people, and you stuck around and asked phenomenal questions. I saw some of them getting answered. I think most of them getting answered in the Q&A. So thank you. And again, just a reminder, we are sending out a survey after this. We all look at all of them, and they are incredibly helpful when creating programming, creating new for future events. So please take a moment and answer that. So thank you, Thach-Giao. It's been wonderful. Sherry, I love working with you as well. I want to make sure you get your shout out, and we'll see each other soon, hopefully. Everyone,